Home births now make up a little over 1% of all births in the country. That's according to the CDC. Midwife organizations say DHEC's current regulations can delay care for women who need to be transferred to a hospital. That's why they're pushing for an act which would characterize licensed midwives and birth centers as maternity providers. Becky Buds tells us more.
For Stephanie and Ken Addison, home is where they felt safest for the birth of their children.
And each of them were really, really special experiences.
Their first home birth was a different story.
Things just weren't really progressing as they should. The baby was turned a little bit funny.
After hours of pushing, she took an ambulance to the nearest hospital.
We received, pretty immediate care, but in most cases that's not how it would go.
Alexander Wagner is one of 45 state licensed midwives in South Carolina.
I have been practicing for 18 years.
During that time, she's witnessed about 500 births, most of which unfolded safely at home. She says by not categorizing midwives as maternity providers, clients could be sent to wait in the emergency room instead of being directly admitted.
We have all the notes, we know everything about this woman. If the midwife is not allowed to come with or give report, that is a problem.
For years, she's been pushing for legislation to change that.
We should have a clear path to the nearest hospital for immediate care.
The Perinatal Integration Act proposal would also allow midwives to access educational opportunities available at obstetrical hospitals. The bill also requires data collection to evaluate the effectiveness and safety of hospital transfers.
It's all about safety.
The Addisons want other families to have the same positive experience they had.
I'd hate for somebody to not feel like they could have that experience.
Because they wouldn't have the option in an emergency situation.
Right. Right.
In Columbia, Becky Buds, News 19 WLTX.
Well, a duplicate of this bill passed the Senate last session but was delayed in the House Medical Committee due to scheduling.
Certified nurse midwives are licensed healthcare providers educated in nursing and midwifery. Certified midwives are licensed healthcare providers educated in midwifery. Both types of midwives have graduated from college, passed a national examination, and have a license to practice from the state they live in.